Well, good morning, everybody, and welcome again to another town hall with the Detroit Regional Chamber. My name is Brad Williams, and I am the Vice President of Government Relations at the Detroit Regional Chamber. And we are fortunate enough today to have as our guest Michelle Kolkmeyer. Michelle is part of Bodman's employment law group, and she is going to spend some time talking with us today about a topic that is top of mind for all of us. Of course, the topic of COVID has been top of mind for all of us for 8 months. But the other morning, I woke up, and like most of you, the first thing I do when I wake up is I reach over and I grab my phone because it's my alarm clock. Usually I hit the snooze button, which I did. But then I looked at my notifications and I said, holy crap, 94.5%, because I saw that Moderna had issued the preliminary results for their next phase of their testing for the COVID vaccine. And that's on top of Pfizer's most recent announcement of 90% effective rate, 90% effectiveness rate for their vaccine. And, I'm not a doctor. I don't know much about vaccination, but like most of you, I'm learning a lot about vaccination pretty quickly. And I know 90% and 94%, according to Dr. Fauci, is better than they had hoped for. So those are great and exciting news. And this is, of course, all under the shadow of the frustrating news that we're getting about the rising case rates and the hospitalization rates we're seeing in Michigan. And of course, the pause that the governor had to put in place just this Sunday night. In light of the fact that a lot of us are going to be spending Thanksgiving just with our immediate family this year, not getting to hug our moms and our grandmas, and that's frustrating too. So all of this is kind of mixing together, and vaccines are certainly important to all of us right now. But vaccines have an important role to play in business too, and what role they play is whether or not people are getting vaccinated and how that is going to get us back to work and back to the office. And so Michelle's going to help us learn some more about that. And I know, Michelle, you had a few things that you wanted to open up and tell us about. But before you get to that, I will let you know for the people who are listening in, you have an opportunity to ask any questions you might have of Michelle. There's a question tab in your GoToWebinar program. Drop those into the box. My colleague Matt Patton is going to be screening those, and we'll be asking those of Michelle a little bit later on. We're going to be here for half an hour. So if you've got questions for Michelle, drop those in and we'll get to as many of those as we can later on. So Michelle, why don't you kick it off? Thank you so much for spending.
Thanks, Brad. And as you just said, we were chatting offline, and we actually postponed this webinar a couple of weeks from our original plan, and just so happens that it couldn't come at a more relevant time, it looks like. So I'm happy to be here with you guys and learning this as we all sort of learn it. So I think probably the best way for me to do this is to just give you a little bit of background on how a mandatory vaccine program would work, whether it's right for your business, and if you think it is, what might be some guiding principles to implement such a program, and then just some general kind of considerations I think that are probably appropriate to discuss. But to our overarching question here, whether an employer may mandate a vaccine or a COVID-19 vaccine specifically, the answer generally is going to be yes. And quite frankly, this isn't really a super new topic. It is with respect to COVID-19, but employers have been implementing flu vaccine programs for a long time. So how COVID vaccines might work is going to probably track that same framework. And again, I think it's important to note that this is such a politically charged and changing climate with COVID that nothing is Bible right now. Things are constantly evolving and changing, and we're all going to have to keep our eyes on how this this moves forward. But generally speaking, an employer will be able to implement a vaccine program. I want to shy away from using the word mandatory, and that's because the EEOC doesn't like the word mandatory. You know, in practice, I'm not sure exactly the reality of that, because if you're implementing a vaccine program, it's so that all of your employees get it, right? But I would shy away from calling it a mandatory vaccine program, first of all. And that said, if you do want all of your employees to get vaccines, I think that there's a couple of things that you should be aware of. That it needs to be right for your business, first of all. That it should be, you should be able to have some kind of a tailored reason for wanting to implement this program. Is it because your employees are often around other vulnerable patients or vulnerable customers, or they have a lot of exposure to customers, things of that nature? The more tailored your program or reasoning for implementing a program is to something like that, the less trouble you're going to have explaining it or defending it. So then that leads me to my next point. Yes, you can implement this program, but there are, of course, as there always are, exceptions. The first exception, I would say probably one of two exceptions here, are for medical objections. So if you implement this program and one of your employees says, I have a disability that doesn't allow me to get a vaccine, or I have sensitivity to a vaccine, the ADA will instruct that we need to engage in an interactive process to come up with a potential accommodation. So what that might look like is deviating from your mandatory vaccine policy by talking through with the employee whether it makes sense that PPE can be used instead of a vaccine, or whether a work from home option is available, whether a social distancing alternative is available. These are things that we're going to have to consider when an employee says, I have a medical reason for not getting a vaccine. There is another rung to this analysis, so to speak. If we are not, as employers, able to accommodate this because it is an undue hardship, we may then mandate the vaccine nevertheless. That is going to really be a more limited circumstance for a healthcare provider or something of that nature. Think nursing home caregiver, and again, I can only speak in generalities without knowing a very specific circumstance. But those are going to be, kind of limited situations where you're going to be able to, despite their disability, still require a vaccine. So the next, sort of exception would be a religious or faith-based exception. And what an employee will need to come to an employer and say is that my sincerely held religious beliefs prevent me from obtaining a vaccine. And sincerely held religious belief is a legal analysis. And I would caution employers from challenging a sincerely held religious belief, because it's not just a mainstream sort of it's beyond mainstream religions, right? So it doesn't have to be, well, my Catholicism or my Judaism is, you know, tell the tenets of my religion say that this is against them. There was one court case where veganism was held to be a sincerely held religious belief in connection to a vaccine type argument. So I would caution employers when an employee approaches you and says that my sincerely held religious beliefs, you know, prevent me from getting a vaccine. You know, I would suggest you need to get an attorney involved before, you know, going to the next step. Again, the undue hardship analysis is relevant here. If you are, let's say, unable to wear a mask, unable to work from home, social distance, and you have a very vulnerable population, let's say. Again, I think a general note to both of these exceptions is these are very legal, these analyses are very legally technical, and it makes sense to get attorney involved in these. So those are two of the general exceptions that I think are worth pointing out just in a general sense. And we can't really say at this point how a COVID-19 vaccine will be handled among the states and handled among the federal government. So that remains to be seen, and most of the case law that's available right now is related to healthcare employees and where patients are involved and things of that nature. So outside of that context, it remains to be seen how this will all be applied. So I think with those two exceptions, if you as an employer do want to implement a mandatory vaccine program, like I initially said, it's going to be important for you to consider whether that is necessary for your business. And the next thing that I would want to caution you is be very prepared before you're going to start implementing this. Come up with the accommodation request form. Come up with what your steps are going to be for evaluating requests for waivers or for disabilities, and make sure that you're going to be able to apply those as uniformly as possible. And in that same breath, documentation is going to be very key with respect to all of this. Like I said, this is going to be a constantly evolving process, and there are likely to be laws that are implemented or regulations that are going to speak to this issue. So the more that we can show that throughout these changes, we have documented the process and we are able to show that we did adhere to general requirements, then the better off we are going to be in defending any decision we make. So I think that those are generally, you know, my points, and I don't want to just talk and talk and talk. I want to leave questions. But as a final point, I think it's important to point out what maybe we all already know, that not only COVID-19, but vaccinations in general are very, very sensitive right now. And so I would just caution all employers, when you're making these decisions to implement a program like this, it makes sense to consider the impact it's going to have on your employees and the culture of your workplace generally. Know who your employees are. If you believe that your employees are going to take a huge issue with this, you know, you need to consider that as a big piece of this puzzle. You know, I think employee culture is very, very important, and this is going to be something that has a significant impact on that. So with that, I think, you know, I'll open it up to questions, and I hope that general analysis was clear and helpful. So.
That's really helpful, Michelle. And if I could ask just one question, I know we've got, it looks to me, and Matt's been looking closely, but we've got a lot of really good questions from the audience. So I won't take up too much of your time with my own questions. But one thing that jumped to my head as I was listening to you is that a lot of the people, the employers who may be the most inclined to look at a system where they required a vaccination might be folks in the healthcare industry or nursing homes, those employing nurses or home health aides. It occurs to me those are in a lot of instances, particularly nurses tend to be organized or members of unions. And so I thought if you have a unionized workforce, is this something that would need to go through a collective bargaining process?
Yeah, that's likely, and that's a great question. A point that I had here, while I was preparing, you will need to certainly run something like this by the union, and that'll likely be a point of negotiation with the union for sure.
Okay. What about what about how this works with the Americans with Disabilities Act, the ADA, and other safety and work conditions? Is there any concern about that and the safety issues, I guess, of a vaccine if there's an adverse reaction, I guess, of requiring an employee to get a vaccine? Would an employer be liable? If I know we passed liability protection legislation in Michigan relating to COVID, but I guess would this cover an employer in that instance if they required an employee to get vaccinated and there was an adverse reaction? I mean, I know there's lots of testing going on, and vaccinations are by and large very safe. They're just trying to think through any potential concerns an employer might have.
Sure. So when I spoke about the medical piece of the equation and the sort of medical objections, so that's the analysis that is going to be performed under the ADA. With respect to your question on whether a sensitivity to a vaccine, how that impacts this analysis. Well, so first, the courts actually differ on whether a sensitivity to a vaccine constitutes a disability under the ADA. So, which is sort of interesting. Meaning, if I have a sensitivity to a vaccine, that may not exempt me necessarily from still getting the vaccine. So I think that that's a great question in terms of what is your liability around that. And I think it's going to depend, as most of this stuff does. But if an employee is telling you that they have sensitivity to a vaccine, and you feel that you have, as an employer, and you've gone through the analysis with your counsel, that nevertheless in the situation it makes sense to still mandate the vaccine or require the vaccine, then your liability is going to be considered in that analysis, right? So I can't tell you in any general sense what the liability for an employer who later has an employee with an adverse reaction. But I think that when you're going through these these analyses, it's important to consider that reality with your attorney. And the other thing I would say about the applicable laws here are, as you probably all know, in October, Governor Whitmer signed a few bills into law that shield employers from various liabilities from COVID-19 exposures. And it, again, remains to be seen right now whether there will be any kind of inclusion or modification to include vaccines in this, but these bills do, or laws now, they do provide the employer with significant shields from liability.
Yeah, and I will mention those bills passed with the full-throated support of the chamber too. And there have been questions just stacking up, so I'm not going to ask any more of my questions. But before I hand it off to Matt to go through the questions that the members have been asked, I will just add that I've been following a vegan diet for 3 months. I plan to get the vaccine regardless of whether I am forced to or not. So Matt, why don't you sort through as many questions as we can get from their audience, because it looks like there's a lot of good ones coming through.
For sure. Thanks, Brad, and thanks, Michelle. Like Brad mentioned, a lot of questions coming in. A couple of the first few themes center around not only who would be required or who would be able to require their employees to get a vaccine. So I guess maybe a starting question would be, if I'm an employer and I want to do, the safest thing possible, am I able to, if I'm not running a healthcare business or an essential work business, and I, own a pizza shop or an auto parts manufacturing, can I require my employees to do this? I mean, are most of them at-will employees, and can I go ahead and do that and then deal with the exceptions later? Or what are you finding most businesses are deciding to plan for?
Sure. So I think, again, the answer is generally yes, though with the caveat that it makes more sense if you have a legitimate business reason or a legitimate health concern. There are no rules to bluntly answer the question. There are no rules that healthcare workers can require, but pizza shops cannot, right? But the more that your policy is tailored toward protecting your customers, protecting vulnerable members of society and things of that nature, the better arguments you have down the line.
Sure. So after that point, let's say I'm a business that does propose that I'm encouraging all employees to get a vaccine, and there's folks that might not like that for whatever reason. You described in some good detail, what the acceptance would be with medical reasons and religious reasons and things like that. I mean, it's a reality. It's been discussed, in recent years. We've all heard people, the anti-vaxxer crowd or something like that just simply don't believe in getting vaccines. Where does the line get drawn? And of course, there's probably litigation in the future, but where do people draw the line with what is proof of an exception? If I'm an employer and an employer tells me, I don't believe in getting the vaccine, what qualifies as a religious exception or things like that?
So that's a good question, and I think what you're really asking is, if someone comes to me and says, I don't feel like taking the vaccine, I'm not interested in doing that. That's not my mentality, and I don't have a medical reason why, and I don't have a religious reason why. The answer is yes. I mean, generally, you're an at-will employee, the same way that if your policy at work is for you to come in at 8:30 and you don't have any medical or any other reason why legally you're not able to come in, and then yeah, I mean you can be fired for that. I do want to note though, Michigan does have some laws around personal choice with respect to vaccines. These laws this law is really geared toward childhood immunizations. So I can't say at this point whether that will have any impact on COVID-19 vaccinations or whether something like that would be expanded. Certainly something to watch, as we all know, this has been such a significant area of dispute. So I just want to point that out to keep your eyes peeled for some new legislation that might speak to that. But going back to your question, if someone doesn't follow the policy and the policy is equally applied, then yeah, you know, that employees are at will, generally.
What about, sure, and thank you for the logical answer. What about businesses that have guests? A lot of businesses either host functions that they have guests, or, you know, by the nature of their business relies on guests. Can a business, how far does the requirement or encouragement for a vaccine go in terms of interacting with customers or clients?
So if I'm understanding the question correctly, it's kind of similar to the last one in that, again, it doesn't have to be a healthcare justification. And in fact, I would go as far as to say you don't necessarily have to have a justification. You know, let's say you are the pizza shop. I think that analysis and that sort of justification comes into when you have someone who says, I have a disability, I cannot take the vaccine, or I have a religious purpose for not taking the vaccine. I think that's when that that consideration really comes into play, because in the accommodation sense, so if I am a tech worker and I can work from home, well, what justification does my employer really have for making me take a vaccine when I don't see anyone? So I think it comes in a little bit more on the back end, on the accommodation piece. But it's something that I brought up at the beginning because it makes sense to be thinking about those reasons ahead of time while you're implementing this. So when you're implementing a policy to have your entire workforce get a mandatory vaccine, does it make sense to tailor that vaccine for only the, you know, in our pizza example, for the delivery drivers who have direct customer contact, for the people that work the counter, you know, that have that direct customer contact. Sure, an argument can be made employee to employee, you know, spread would be a reasonable threat as well. But, you know, if you're trying to think about protecting your customers and the vulnerable population, it might make sense to require certain positions to obtain a vaccine versus the backroom tech, for example.
That certainly makes sense. You mentioned the liability law and that might require modifications. Do you think the current liability law we have now protecting employers? I mean, a lot of employers are doing great things in following the law, and even before there was the law, a lot of employers were doing great things to implement safety protocols. Now a lot of that is memorialized in law, and without those safety protocols, the liability protection, I believe, does not exist. So with having now the vaccine in the picture, could cut both ways, as Brad mentioned a bit. If there's negative consequences, physical consequences of getting the vaccine, and something happens with your health, and an employer requires it, is that something the employer would still not be liable, or is this something that would be new and law would need to be changed to account for these new requirements? Or would you lean on, like you said, the child vaccines? Is there enough case law out there or not?
So what I would say with respect to the Michigan laws shielding employers from liability is, the way I would look at that is employers can feel more comfortable not mandating vaccines. So in the situation where you do have a situation where you have customer contact or contact with vulnerable populations, and you do want to require the vaccine for those specific positions, and then some might say, well, what about the other positions? There's nothing to prevent me from having a major IT disruption when my entire IT staff gets infected. you know, and I think that that's a reasonable argument, but at the same time, you know, your liability for any spread of infection in your workplace like that is going to be protected under that law, so long as you're following protocols and the COVID-19 CDC guidelines. So I'm not sure if that answers the question specifically, but that's how I envision the Michigan liability laws impacting this analysis. To the extent that vaccines play a role in that law, I can't say for sure right now, because the law just doesn't speak to it at this point.
Sure, I think a lot of folks will be thinking about it, you know, continue now and into the future. But one final question, I think we're looking at time, but I come from a military background, and we were required to get just about every vaccine available, probably more than people know exist. We've faced pandemics in the past before our generation and those before us, and historically too with other things like polio and things like that. Is there a history of vaccine requirements with those previous diseases and pandemics where there were requirements? And I guess, do we know how we handled that in the past in terms of requirements?
I'll leave the history lesson to you on that one. But what I will say is that I think we're going to see some real pivoting in the legislature here very, very shortly. I think there's going to be, I suspect that there's going to be a lot of regulation around this, because everybody's grappling with the same thing, right? We're all trying to figure out how to protect my workforce and how to protect the situation where your entire IT staff is infected with COVID-19, right? So I think that there is going to be a lot of significant legislation around this, and I'm not sure if it's going to come at the federal level or at the state level, but it's going to be really, really interesting to see how we all deal with the fact that we're in the middle of a pandemic. People should be getting vaccinated versus the ideology of I don't want to be mandated to get anything, and the sort of anti-vax argument as well. So I think that there are certainly two sides of the coin to look at, and legislature will have its work cut out for it.
Well, Michelle, I want to just say again, thank you so much for spending this time with us this morning. It's been really helpful, and just by the volume of questions we got, we didn't even come close to scraping the surface. And so I would encourage everyone who's listening in, before you go too far down this path, to talk to your attorney. There's no way we're going to be able to provide you enough guidance to go down this path in a webinar or a town hall today. I also want to make sure you know that this is not necessarily something that the chamber itself is saying that all of our employers should go down this path. This is something that we've gotten enough questions about that we thought it was worth bringing in an expert like Michelle to start providing you some answers on. It's something that we think everyone should get vaccinated when we have a safe vaccine available, and this should be something that employers should have the ability to take a look at. But we're not saying every employer should do this the minute a vaccine is available either. But Michelle, thank you again so much. This has been so helpful and actually really fascinating to learn about for me, someone who's not an expert on either vaccines or employment law. So I appreciate your expertise here. And thank you to everyone who listened in. This whole session has been recorded. We're going to archive it and post it on the website later today, detroitchamber.com/COVID-19, so that you can go back, listen again, share it with your colleagues and your friends, and share it around. So thank you very much for listening in. I think on Thursday, we're going to be doing another one of these. So be sure to listen in, and we'll be sharing more information about future sessions. So check your email inbox. Thanks so much, and have a good rest of your day.